Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. All right, George, tell me what's going on with your shoulders. What happened?
Okay, I think I overused my shoulders. I was helping a friend cut down a tree
Okay.
from being up in the tree. So
Mm-hmm.
I climbed up a ladder and then
Okay.
climbed up higher in the tree, and then I carried the chainsaw up and then cut down limbs,
Okay.
and then I reached higher, as high as I could above my head with a chainsaw,
Mm-hmm.
and my arm would go numb, and then I'd switch,
Mm-hmm.
and then I would.
How many hours did you do that?
It was like 6 hours the first day, and
Oh, wow.
probably 5 hours the second day.
Wow.
Yeah.
Okay.
And then I used a
So-
tree saw,
Mm-hmm.
like this action too. When I couldn't reach with a chainsaw, I'd do this, and I did that,
Okay.
yeah, until I couldn't feel my arms anymore.
So you did that 6 hours, 2 days. When did you? How long this How long this been going on?
It's been going on over 2 years.
So 2 years. And did you have any MRI, X-ray,
Yes,
or
I had
anything?
MRI on, well, I had x-rays on both shoulders. I had
Mhm.
MRI on both shoulders,
Mm-hmm.
and I was told by a surgeon that I had multiple tears in both rotator cuffs.
Both rotator cuffs,
Mhm.
and any what recommendation they give you based on
Recommendation was, they said I owe it to myself to have physical therapy done first,
that? Mm-hmm.
because the
Mm-hmm.
shoulder surgeries wouldn't be able to be done at the same time, and the recovery would be, it takes so long.
Too
They
long.
recommend
Yeah, and
physical
you have
therapy.
two shoulders at the same time. Yeah, you
Right.
have a shoe. So have you had physical therapy?
I've had physical therapy at a couple different places. They gave me some home exercises to do,
Yeah. Mm-hmm.
and they really didn't help me.
Mm-hmm.
I think the surgeon was hoping the physical therapist would know what to do,
Mm-hmm.
but they
They just give you
they didn't.
exercises.
Yeah, they gave me exercises, and they told me to take naproxen sodium
The-
2 every morning
the
and 2
physical
every
therapist?
night. Yeah.
Oh
He
wow.
said take this for the next 6 months, every morning and every night, 2 pills.
The
every
physical
morning.
therapist?
Yeah,
Wow.
because of inflammation from the tears.
Hmm.
Take pain medicine.
Did you do that?
I did.
6 months?
Yep, 6 months.
Okay. What else you had?
Ibuprofen,
The other treatment
other treatment on my body.
for the shoulders.
Okay,
Like you had the physical therapy. What else?
I had physical therapy on those, and then many appointments with massage therapy.
So you had massage therapy, physical
Yes.
therapy. What
Yep,
else?
at a therapist.
Mhm.
So then I've gone to a chiropractor,
Chiropractor.
and they would
Okay.
adjust my neck and my back, because they said that's why my shoulders were hurting, because my back was out of line.
Okay.
So they would crack my neck and said, try that and come back. So I did that, and then they would take a thing that went kunk, kunk, and they'd do it in my shoulder, and they said that should be better. But
Okay.
I would spend hours with deep tissue massage, like
Mm.
2-hour appointments,
Ooh.
and I've been doing that for years as well.
So you tried everything. You tried massage, chiropractor, PT. What else?
Well, I had an appointment to have that gastrin technique done, but I
Gastrin,
canceled it
Mm-hmm.
when I showed my wife the video of it.
Mm-hmm.
We canceled it, and then she had me come up to see you.
Yeah. I'm glad you're here. So everything should be pain-free. Can you tell me right now how much pain do you feel there and how we aggravate your symptoms so we can use that?
Okay, so today all I did was ride in airplanes, and being still does hurt, but it's not like working. So right now I'm only about a 3 to 4 in my shoulders.
So
just
3
sitting
and
here.
4, that's constant.
It's just constant, yeah.
Where do you feel it?
I feel it right here in the back part,
Both sides?
both sides, and they're about
So
3 to
the-
4. And then in the front, right here, is about a 1.5.
Okay.
It's really tender if I touch it.
And at worst, how much?
When I work,
You know, when you aggravate the symptoms, how much pain do you usually get if we want to aggravate it now?
I'll easily be at 8 or 9.
8 or 9. How can you do that now? Aggravate your symptoms?
Well, if I push mow
Mm-hmm.
my yard, or weed eat, or leaf
Just
blow.
Lifting.
And holding things, moving like that, that'll
Mhm.
aggravate it, and I'll get to an 8 or 9 all night long in my sleep, and I'll take pain pills to to try to go to
Okay.
sleep.
But if we want to aggravate it now, can we aggravate it with like push-up or something like that?
Push-ups would hurt it, but it would hurt through here, and then
Okay.
in my arms. To
Okay.
aggravate this, the motions that I do are usually, weed eater vibrating or a leaf blower vibrating.
Mhm.
But a push-up could cause that because I got extreme weakness now because the pains.
Okay.
So that pain, when I do a push-up, it doesn't go back here. It comes up
It
here.
comes with okay, let me
Yeah.
see, like I have a little bit weight, or weight I'm not gonna do it.
Okay.
Let's
Oh, but if you had a weight, I could move it around like this in front of me like that. and
yeah,
it
yeah,
aggravates
so
it.
this is total like 5 pounds, so
Okay.
let's try this and tell me how much pain, because I wanna use that for testing before and after treatment.
Okay.
And we'll try it on the other side too.
And that's it. That's the motion right there. It's massive pain right
How
there.
much from 0 to 10?
Like right here, two, and then 8,
Okay.
and then it'll get to the point where I'll start drop. I'll just
Try it
lose all
on the
my
other
strength.
side.
This one's going up here.
Mm-hmm. Not much.
Not as bad as this side, but right through here, it's probably 6 to 7.
Okay, and that's with 5 pound weight.
Yeah, and then it started to get hurting in my elbow, right
Okay.
underneath it,
Yeah.
hurting down there.
What's happened here? You have a scar tissue now.
They did radial tunnel surgery back in 2010,
Mm-hmm.
and because I couldn't even write anymore, and so they cut me open. And you see, they did a
Yeah.
nice chalk line on that.
Okay, can you take your... have you actually... Let's just start work on one shoulder. We'll work on the right shoulder first.
Okay.
Okay, you have a mark there. What's going on? That's
Birthmark?
That birthmark,
Yeah.
okay. So I will have you actually turn this way.
Yep.
Okay. So make sure it's not painful. Any accidents, trauma?
Yes, I forgot to tell you about that. 2008, I was with a guy on the ice, and he hit a tree head on
Mm-hmm.
my side of the truck, and I put my hands forward
Mm-hmm.
because we were going at a tree, and my hands caught before the seatbelt did, and it
Mm.
jammed his shoulder, and I got a pain inside my right shoulder blade, deep inside there, really deep inside the right shoulder blade.
Mm-hmm.
Yeah. And it's never gone away,
Mm-hmm.
and I've had a lot of massage and chiropractic.
How
on
much
that.
pain from 0 to 10?
There's none right now.
Mm-hmm.
No, but when I start working with it, it'll go up to about a 6 or 7, and then I have a hard time breathing. It affects my breathing.
Yeah.
So it goes all the way through, and I believe there's scar tissue deep in there.
Yeah, I'm gonna want to come back to it. Okay. Make sure you tell me if you feel pain, okay?
Okay.
That, how does that feel?
I mean, a little bit of sting
Okay, make sure it's not too much. What
at
about
the, at
now?
the tip. There's a little sting there, but not bad. It's not pain, just like
Pressure?
like a pointer, like a.
Yeah, if you feel pressure, that's fine, but pain is not fine.
Nah.
To work on. Need to not causing pain. How's that?
Not painful, just pressure.
Mm-hmm. Have you actually wrist here on? How's that?
Doesn't hurt.
Okay, that's good. They did not tell you which of the rotator cuff the test here.
What's that?
They did not tell you which Which part of the rotator cuff that has tear?
I don't remember. I thought it was up here in the front because that's where it hurt, but they said that it goes through, it's in the back. And then as I started digging around, I'd find it, in there. I'm like, oh, I think I know what they mean. Like right in through there, you can feel it on both sides. But it wasn't as that bad when they did the MRIs. It's gotten worse over the last couple of years.
Okay. And you're still active?
Yeah, I mean, I work at home and on jobs. I tore out some stairs going down to the lake last weekend, and I couldn't put them back in because I was in too much pain. So they're left undone. So so if you help me next weekend, I'll fix the stairs going down.
Oh wow!
Yeah.
Man, you work very hard. Is that too much? You feel that scar tissue here? You feel this bump?
I feel something.
That's a scar tissue.
Oh, that's another thing they said. I forgot to tell you. My neck connects to my shoulder, and the massage lady, she found that too. She's working at this. Something's going all the way up in there because she was really working in that. My neck has got a mess in it, I guess.
Yeah, you feel that? That's a scar tissue.
Like all those little bumps, just
those
bumpy.
That's scar tissue.
That's scar
I will
tissue.
show you.
Oh.
I will show you the area that you didn't have the scar tissue in.
Okay.
Let's see if we have a good example. Okay.
You're looking for no scar tissue?
Yeah, you feel that? How nice and smooth?
Smooth, yeah.
Yep. There's no scar tissue here.
I'll be
Compare
darned.
this to. You feel that bumpy? You feel that?
Oh yeah, it's rough.
That's all scar tissue.
I'll be darned.
You feel all this bumpy area?
Yeah.
Yeah.
All of it.
That's the scar tissue here. So.
Feel it in there, yeah.
Yeah. It's kind of like has a sound here too. Feel it?
Oh, totally feel it, yeah.
Okay. So I'm gonna do your whole arm actually because you said you have a tennis elbow too?
Yeah, and it even generates all the way down underneath there. I
The whole thing. Okay.
didn't even know that was possible.
Not too much here.
No. That's scar tissue too?
Yeah, you feel those bumps? Yeah.
Yeah.
Because otherwise it should feel nice and smooth like this.
Oh my.
You see that? You
Yeah.
feel the difference?
Yeah, it was smooth.
Yeah. So that is in here. Feel that, and you can
Yeah.
see it actually.
And I know, I
Tool,
mean, I've had pain in there. Oh,
is that painful what I'm doing?
no, but I mean, I've had pain in that, so it makes sense.
You see that?
Yeah, it's like
you see jumping?
it's all
Yeah.
rough.
Yeah, it's like you have like a kind of marble size here
Oh
of
my.
a scar tissue. Here's okay. It's a little bit in here. So here. So you have a lot of scar tissue.
I believe you might find a lot or something.
Well, listening to your history with those, like, you did a lot of physical work, so
Yeah.
I'm not surprised you have scar tissue everywhere with you injured that side.
Yeah.
Okay, I will have you actually turn around.
Okay.
Facing this way.
Okay.
You're gonna work on your elbow, and you can see the redness where you have the scar tissue. Here, you see that?
A little bit, yeah.
Yeah. Okay. So let me work on this area.
I'm colorblind, so but I can see a little bit of redness.
Yeah.
But
But you felt it. You felt
Yes.
the bumps. Yeah.
Yeah, very bumpy.
Yeah. Mm-hmm.
will that go away?
What the scar
bumps?
tissue?
The bumps?
Well, it depends on the size of the scar tissue. So if it's a thick scar tissue, it takes a few sessions,
Yeah.
and it depends on your genetic too. So if there's other comorbidity, the body's slow to heal. So we'll see how you respond to
Okay.
the treatment.
I think I told you the pain, it even went down in my hand into this part was hurting and my knuckles started hurting.
So
That's only happened in the last month.
what did
started
you do
resonating.
before that?
Huh?
What did you do before you feel that pain? Did you do any repetitive motion?
Well, I don't know if my wife thinks the massage therapy, she thought that it was making it worse.
Don't do
because they
deep
were
tissue
very
massage.
deep. They were
Yeah.
doing deep, very deep. Matter of fact, they asked me how deep I wanted to go, and they go, "We got a girl that can go real deep. She'll put your hurts on you." And so I picked her. I picked the toughest, meanest girl to get in the deepest tissue she could.
Okay,
And
please don't do that at home.
yeah,
Uh,
my
yeah.
wife said, "I
That's
think
cause
it's hurting you."
inflammation. It's cause
Mhm.
more inflammation.
That's
Think
when my
about this
hands
way:
started
if you
hurting.
have a cut, okay, do you keep rubbing it
Mm,
to heal,
mm,
or yeah, deep tissue massage is really,
mm.
you know, if you feel pain, that's mean it causing
Oh, I felt
injury.
pain.
You
Yeah,
know?
I grit my teeth
So
for an
the
hour.
idea of no pain, no gain, it's not really valid because
Mm.
it's similar to your, you know, when you have a problem in your car, like, and you have the check engine signal light.
Mhm.
So pain is similar to the check engine signal light. So
Mhm.
there's two options for it. One is either cover the signal, keep driving and hope for the best.
Mhm.
I don't want to drive with you.
True.
Or two, just stop, fix the problem, and the light will
Mhm.
disappear.
Correct.
So if we push the pain, there's might be a micro tear that will causing it to be worse.
Mm.
So we don't want that.
Yeah.
Okay. So the elbow both sides or one side?
Yeah, it's on the top, and then there's even a spot that I found that goes right. I found it right in here. This whole area is just on both sides. Like right there is a knot,
Okay, relax.
and it's on both arms.
Relax. Is it painful here? It's okay. How's that?
Yeah, I mean it looks like it should hurt, but it doesn't hurt.
Yeah. Feel this one?
Yeah, I do.
Mm-hmm. Yeah, and you see this on this side.
Yeah, it goes clear through the bottom.
Mm-hmm.
I don't know if the pain just transfers through that or if that's another problem.
I usually refer pain for this issue, this common with tennis elbow. Okay. Alright, so let me hold your towel. Okay, so I want you to move and tell me, how is the pain now from 0 to 10?
Oh, well, I'm able to pull that up further now. It's not as tight.
And move it around because you were moving it. You're stretching now.
Yeah, I couldn't. I was trying to do that in the airplane, and I couldn't. It hurting so bad.
And how is it now?
I got better range of motion. I don't feel.
Do you feel pain or it's gone?
I feel some, yeah.
Where do you
But
feel
I'm pushing pretty hard.
Where?
I'm feeling pressure through here and then pain. And
How much from 0 to 10?
it's probably a 4 to 5 now. And
Okay,
see
don't
this?
push it, don't push it, don't push it,
Okay.
okay?
That's where I'm feeling it.
Okay, I want you actually to bring it up, but without pain.
Bring it up?
Yep. Without pain. Just, can you relax, lower it down?
Yeah.
Just rest it this way.
Okay.
Is it painful here?
Mm-mm.
Oops.
Is that scar tissue too?
No, no, it's about here. Okay. Let's try it again.
Okay.
How's that?
Oh, it's a lot better.
Mm-hmm. Any pain or it's gone?
There's still some pain.
How much from 0 to 10?
Like a 2.
You feel it right there?
Yeah.
Mm-hmm. And what about your range of motion?
Yeah, it's really greatly improved. I mean, I can touch my back now.
Beautiful. Okay.
Yeah.
Let's show the pain is right in here. Let's relax. Right
Yeah.
in here.
Mm-hmm.
Okay, relax. Right in here, yeah?
Yeah, and then I felt it going down here.
Okay.
For some reason.
Well, oh, look at this.
Yeah, it's a
You
mess.
hear that sound?
Yeah, it's a mess. I mean, I know it's been in pain at night. Sometimes it's so bad.
So,
I've even been trying for the last month putting CBD oil on it to help, see if I can help it, go away. And
it's not gonna break the scar tissue.
no,
You have to have mechanical force to break the scar tissue. You feel that?
Yeah.
You,
yeah, it's like all
you hear
gritty.
that?
It's like
Yeah,
there's
yeah, yeah.
it's like,
So, scar
it's like
tissue.
there's sand in it.
And
Look at that.
Here.
That's scar tissue, huh?
Mm-hmm.
My goodness.
You feel that? And
It's like
I don't know. I
it's
can
not
hear
smooth.
it actually now. Yeah.
You can hear it.
Yeah, I can hear it and I feel it with the,
Oh yeah, I
the tool.
feel it.
Yeah,
There's,
yeah, you can see it actually with the tool. It's just like vibrating.
yeah, it's not smooth at all.
Yeah. Okay. Let's try it out.
Okay.
We're moving faster now.
Yeah, couldn't do that before.
How's that?
It's much improved.
Mm-hmm. Any pain or it's gone?
I feel it.
No, you're gonna feel that because you have a scar tissue. We still have to work on the
It's
rest
like,
of the scar tissue, but
Sure.
the pain, that's what I care about.
Yeah, there's just
How much and where?
it's right here, and it goes to right
How much?
here. Probably one and a half. So the here and here at the same time, it just kicks in at the same time.
Yeah, because you
It's
stretch.
like something pulling on here.
Oh, both. Okay, relax. George, can you tell me where you're coming from?
Indiana.
Indiana. Wow.
Yeah,
That's a fly.
yeah.
Yeah.
I was a flight from Indianapolis to Dallas and then to here.
To California. Wow.
I heard a guy that flew here from Atlanta, and I'm like, I'm coming from Indiana.
Yeah.
Yeah.
Patient from all over coming. Let me see. This is. You feel that?
Oh yeah, I feel it.
Yeah.
How it got there,
You
I
can
don't know.
you can see my hand is
Oh,
just
yeah.
you see it's just going like this.
How it got there, I don't know.
Scar tissue from repetitive motion, repetitive strain injury. When you were doing that, you
Hmm.
probably strain your
So I
muscle.
never had problems with
Strain
my
your
biceps
muscles.
before that happened.
Well, you strain your muscle and your body has to build the scar tissue. Otherwise, it will not heal. Remember, like the healing cycle when you have external cut,
Mm-hmm. Yeah.
you get an internal cut. Your body has to go through the same process, but it's internally, so we don't see it.
Sure.
So you get that internal cut. Your body has to build the scar tissue, so it will glue together.
Hmm.
If it does not build the scar tissue, it's not gonna heal.
Can't heal. Yeah.
Yeah, is that too much?
It's pressure, but it doesn't hurt really bad.
As long as it's pressure is okay, but pain is not okay. Okay.
Okay.
Here you go. This one.
Yeah, that's painful.
Sorry. What about now?
That's not bad. It's just really tender area.
Sorry. No, it's okay.
Yeah, it's just pressure. Yeah. That's okay. That knot's been there for quite some time.
Mm-hmm. You feel it? Man, George, you have a lot to work on.
I know.
Mm-hmm. It's in here.
Mm-hmm. Yep. Just about found it there.
Mm-hmm.
Yeah.
I don't like this.
Hmm.
This is it's actually going down, but yeah, it went down here. It's just a little residual here. Feel this?
Oh yeah, I
Is
feel
it
it.
painful?
Yeah,
Okay, make sure this is not painful.
not too bad.
Sorry, what about now?
That's okay. Yeah.
Try it again.
Okay. Oh, that made a big difference.
Mm-hmm. How's that?
Yeah.
Any pain was gone?
Of course, it moved up my arm. I know we're going to get to it, but
You have
But
several
because I'm
issue-
able to
you have
stretch-
severe issue.
I know because I'm able to stretch further now. I feel going up under my arm, but at least this is changed here.
What I care about, we're gonna work on the elbow and the rest. That's I just wanna. The good news is actually when we release one area, your brain start to.
Look
oh,
where my
wow,
arm
that's
is.
higher. Wow, that's nice. Beautiful.
That's an area I couldn't get to.
Yeah, you did not. Oh, we should have that.
You should have recorded that before
Recorded
because
that. You can turn around.
there's no way I could do
turn
that.
around.
Oh,
I'm sorry.
yeah.
Yeah, before,
So
we
before
started,
I was like right here, and I had to arch my back to get it,
Mhm,
and
that's-
now just take it up,
it's right here to his shoulder plate, right in here.
and I can move my
Before it was
hand.
here.
Before I take it back, my arm was just
Yeah.
numb. Maybe just go numb.
Yeah, so let's turn around and we'll try the weight.
Okay.
If you have tear, you're gonna feel pain from that.
Okay.
The pain from the tear. But if it could be the pain from
Should
the
I go
scar
up with it
tissue.
too, or not?
Yeah.
I can feel I'm weaker. I've lost muscle, but not
Weak is.
But before
we
I
work
came to
on the
see you,
strength. Yeah, we did this.
I lost a
again.
lot of muscle.
Yeah, how's that?
That motion right there is making me hurt.
How
through this
much?
area. A 2 to 2.5.
Okay.
It's coming through here and transferring back through there.
Okay, let's put this pillow again. Now we have to work on this one. So now let's test it with the weight.
Okay.
Mhm.
Yeah. So when I moved back
Mhm.
back and forth, it really hurt, and now. I mean, I'm shaking a little bit, but it's because of strength.
Shaking, that's weaknesses.
But I'm not
Yeah.
hurting.
As long as it's not pain, you probably will feel tightness, and that's
I
normal.
got tightness
with a lot
here,
of-
in here, but it's not.
Mhm.
There's a little bit of pain. I would say a 1 to 1.5
Mhm.
with pain, but mostly tight. Mostly it's just
Yeah,
tight
we
here.
still have more
and
scar
here.
tissue to work on.
But that's pretty good because I'm holding it straight out.
Mhm.
That's
Yeah,
a
so
big difference.
what do you think about the treatment? You just have like a few minutes working on his shoulder.
It's exactly what I was hoping for.
Mm-hmm.
But as bad as this was, to be honest with you, I didn't think you would be able to help me that quickly.
Mm-hmm.
I figured this would take many sessions.
Mm-hmm.
So I'm not surprised, but
Mm-hmm.
I'm happy that you're making results because I've not been here
Mm-hmm.
very long, and this is our first treatment. So,
Yeah.
I do believe in this, and this is why we got plane tickets to come out to California.
Yeah, we're glad to have you. I'm
See
glad
you.
you're feeling better. That's our
Yeah.
goal. Yeah.
That's
Thank
a big
you.
deal.
Awesome. Thank you.
Yeah.
Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.